So good evening, everyone. I am Dr. Tanima Singhal and I welcome you all on this enlightening Ask Me Anything session. So welcome you all and I hope that I am able to answer your questions. So first I'll take the questions which are asked by you all in the form which you have filled. First I'll answer those questions and then I'll answer the questions which you are writing on Q&A. So let's say a hello first fast. Let me just allow you all to talk to me so that we can. Yeah, so I hope you all can see me. I mean, you all are able to write. So give me a hello, everyone. Just write a hello so that I know who all are there. So I can see some moms. Hi, Biswajit. How are you? Good. Gayatri, Ashwini, Ratna. Awesome, girls. Very nice. So let me see who all are present here. So Ashwini, there are two Ashwinis here. Ashwini Kalor and Ashwini Kamle. Sanya, Deepti, Divya, Gayatri, Gitanjali, Haripriya. Some iPhones are also there. The names are not written, but iPhones it is saying. Jansi, Jyoti, Durga, Karishma, Madhurima, Manjari. Hello, everyone. Megha, Monica, Navya, Oppo, Pujita, Ratna, Revati, Snekiran, Shruti, Sre, Teja, T. What is T? Some initials are also written. Oh, the numbers are coming very fast. So Durga, awesome, very good. Voice कम आ रही है अच्छा ठीक है अभी ठीक है अभी awesome अब ठीक आ रहा है good करिश्मा अभी आवाज ठीक है बेटा just check out is the voice okay now अभी भी कम आ रहा है तो मुझे बताओ करिश्मा will be about to speak. That depends on how many questions I have. If I have a lot of questions, then I might not allow you all to speak. But if I have less questions, I might allow some of you to speak. So let me start the session now so that we finish it on time. I know you all have small babies. So we'll try to finish it on time. So Madhurima, if we have time, I'll ask you all to unmute. Okay, so let's start the session. So I'm putting the chats on host and panelist. Whatever questions you have, you can put in the chat, in the Q&A so that it is all organized and we answer it properly. Okay, so first I'll take the questions. So first question is from Andrila Das. Low milk supply and baby doesn't latch. I understand, see, these two things are interrelated. Baby is not latching because the baby needs milk and there is no milk or less milk. If the baby is latching but there is no milk. So both of these things are interrelated. So we need to, whenever we have to work on these things, that the milk is less and the baby is not latching, then we can't work on one thing. We have to work on both the things together and simultaneously. Now there are some more things into this, that what is the age of the baby? What is the gap between last feeding and today? So all these things have to be kept in mind when we plan out the treatment plans for moms. So now, sorry, so I have a little cough. So just pardon me for that. So when we talk about history, first we take, so if it is a small baby less than 2 months and the bottle was introduced from the beginning and the baby doesn't know how to latch. In that case, first I work with moms to increase the milk supply and we try to put the baby on the breast in between. Keep trying for that. And because less than 2 months baby, it is the best time to get them on the breast. Now, if the baby is more than 2 months and baby has never latched before, in that case, first I ask the mother to regularly pump and keep trying for skin to skin and all these things so that the baby get used to the mother first. And sometimes the baby latches for a few seconds. The mother gets that confidence. Oh, my baby is ready to latch. Then on this confidence level, I can push the mother to try more. So when I talk about the treatment plans, when I discuss with moms, then this is a teamwork. I can't dictate that, okay, do this, do that. I have to always talk to the mother She'll see her routine, what are her challenges, and accordingly plan out a treatment plan for her so that she knows, okay, this is the thing I have to do. Then she has to follow for 1 week, come back to me, discuss the things with me. What are the challenges? What are the good things happened? And accordingly, I plan the treatment further. So this is the way of dealing a breastfeeding issue. So now, as the first question of Andrilla, that the milk supply is less and the baby is not latching, in that case, I will suggest start working on both the things. For increasing the milk supply, there are many things which I'll keep telling you. And throughout the session, I see most of the questions are around the low milk supply. So that I'll guide you. But for latching, please try to put the baby on the breast as per the baby's demand. Once the baby starts, even for few seconds, please keep trying on that. So baby has got no personal grudges with you. It's just that baby is hungry, baby wants milk. And if it is good milk, good flow, latching is good, then the baby will perfectly latch. But if the supply is less, if the flow is less, or if the latching position is not correct, then the baby will not latch. And I have seen many times the mothers are latching in a very different way. Just putting them on the chest and just feeling that the baby will latch by themselves. No, if the baby has to latch that way, the baby would have latched from the starting only. If the baby is not latching, that means you need to learn the latching techniques and you have to teach your child also. This is about the latch. Now for low milk supply, there are few things you have to work upon. First thing is demand and supply. Now, if your baby is taking formula milk 6 to 7 times, and if you are not feeding at all, then, or if you're not pumping at all, then how will your body know that your baby needs milk? You need to create demand on your body to get milk. So first of all is the demand and supply. Second thing, along with that, to improve the supply, there are a few things like you have to work on your hydration, you have to work on your flow. Third thing, you have to have a lot of skin to skin and cuddling with your child. You have to also have some galactogogues, so some allopathic drugs or some herbal drugs, depending on what is your history, what is your formula milk in your baby's formula milk intake. I suggest those things. And then the most important thing is tracking. If your baby's weight is increasing and baby's formula milk is coming down, you will be more confident, correct? So we have to track the baby's formula intake and baby's weight gain. If the baby's weight is increasing and baby's formula milk is not increasing, or the formula milk is coming down, that means you're on the correct path. You just need to follow this and keep moving, keep tracking, keep reducing the formula milk, so that one day you will be on exclusive breastfeeding. So this is the way you have to work upon breastfeeding issues specifically pertaining to low, low milk supply and latching. I hope this is clear. Let's move to the next question. Next question is from Ashrafunisa, no milk supply. So previously we talked about low milk supply. Now it is no milk supply. So when we say that there is no milk, then this is called as relactation. So I also work on relactation and I have some awesome stories of relactation. One of my mother whose baby was 2 years plus, she started relactation journey with me with zero milk supply and we reached up to 370 ml of breast milk. Any of you who feel demotivated whether this will work or not, please go to my YouTube channel, search Dr. Tanima Singhal and you will see my channel. You will see a lot of success stories are there where you will find Kiran's story. So Kiran from Panchkula, Haryana, her baby was 2 years plus when she reached out to me and we increased up to 370 ml of breast milk for her per day. So this is the whole thing. So there are a lot of things around relactation. So if there is no milk supply, then obviously, first of all, we have to increase the milk supply and that has to be achieved by pumping. Please don't keep in your mind that if you are working on relactation, that means the milk supply has dropped to zero or few drops. Then the baby will not latch in the initial time. We have to first build up the supply. And then once the milk supply is coming in, you start seeing milk on every pump or every hand express, you will start feeling confident. And once you will start feeling confident, we give tips on how to get your baby on the chest. Once the baby starts coming on the breast for a few seconds also, that is the game changer. And then we keep on working around all these things. And I have a lot of success stories of babies coming from bottle to breast. But all this need peace, focus, guidance. If you are thinking that, okay, I can work around myself. See, if breastfeeding had to be done by itself, it would have started from day one. If because it is a natural process, it would have started for it. But it doesn't come naturally to every mother. Why do we expect the same kind of thing for every mother? Please don't over expect from yourself. If you are having some issue, take guidance from an expert, get the issue resolved fast. There are a lot of worries already in our life. If you keep working around this, that, oh, let me try this, let me try that, the time will pass on and you will feel more frustrated and tired. And sometimes you might also give up. So better is to take help from a guidance from an expert, and that way it will be resolved fast. So anyhow, I'm trying my best to tell you all the tips and tricks, but preferably it is always good to have guidance from an expert. Next question is from Pratyusha. Low milk supply and latching issue. This we have already covered. Varnita Shah, low milk supply and poor latching. Want deep latching with good milk supply. So low milk supply, we have already talked. Latching, we have talked. Now we will talk about deep latch. So let's understand what is deep latch. So all of you, when you're sitting in front of me, now put your tongue on the upper palate. All of you touch your tongue to the upper palate. What do you see? A dome kind of thing you can see in the upper palate of your mouth. Now, the nature has planned the anatomy of the baby's mouth and mother's breast in a way that once the baby is on the mother's chest, the mother's nipple should go in the that dome kind of thing which you are feeling. So that is the soft palate. So our roof of the mouth is two parts, hard palate and soft palate. So the soft palate has got dome kind of a thing. So mother's nipple should go there. And the hard palate, which is just behind the teeth, both the teeth, the hard thing should be on the areola. Now imagine when the hard part of areola is hard part of the mouth of the baby is on the areola, the more milk will come out and will be a deep latch. So deep latch is always an asymmetrical latch where the lower part of areola will be in the baby's mouth and upper part of areola will be visible. So this way the baby will be having a deep latch. And how is this beneficial? Because more milk will be transferred and it will be at a faster pace. So baby will finish the breast faster. The mother will feel much better because the baby will take less time on the breast and the breast will be emptied fast. So this way, the less time will be spent by the baby on the chest. Mother will be more relaxed. And when the breast is emptied properly, there is better milk production because the body takes it that all the milk has been finished. So it starts making more milk. If the breast has milk and it stays back in the breast, the brain takes it as an extra milk and it starts reducing the milk supply. So this is all about deep latching. I hope the things are getting clear to you. You can just write to me on the chat box if everything is getting clear to you so that I understand that, okay, all of you are understanding what I'm trying to tell you all. Next question is from Divya. Want to switch my baby from formula to breastfeeding. So basically, if you want to switch your baby from formula to breastfeeding, there are a few things here. Is your baby on exclusive formula? Is your baby on mixed feeding? Formula plus breastfeeding. So, and then breastfeeding also, is the baby doing direct feeding or are you pumping and giving to your child, or you are doing all the three things? You are direct feeding also, you are pumping also, and you are giving formula milk also. So what we have to do, first of all, we have to take the history. See, history is so important for any kind of medical disease when we talk about. So even for breastfeeding, I need to first understand the history. Just answering randomly will not help you and it will not be clear for me also. So now we will take one by one all the three conditions. So if we are talking about shifting the baby from formula to breastfeeding. So now if the baby is on exclusive formula, no breast milk, That means it is a relactation case. We have just discussed about relactation. Now, if the baby is on mixed feeding, where the baby is also taking direct feeding and the mother is also dependent on formula milk, in that case, we increase the milk supply, where the conditions of low milk supply, which I just answered, will come in there. And for latching, because the baby knows how to latch, the mother knows how to latch the baby, so we will try for more and more latch on every feeding sessions. Now, third condition is when the baby is given formula milk and the mother is pumping and giving milk in the bottle. Now, if the mother only wants to increase the breast milk supply, then the pumping needs to be optimized. Many times I see mothers pumping for 30 minutes, 45 minutes, 10 times, 12 times a day. That is not compliant. You will not be able to pump for so long, and for how many days you'll keep pumping such long time. So basically in that condition, I give the mother's pumping routine as per the mother's routine. And those pumping routines have to be discussed with the mother. Each mother is different, so we have to plan the pumping timings as per the mother. But I make sure that the mother doesn't spend time for 10 to more than 10 to 15 minutes on the breast pump. So this way we have to optimize. Now, if the mother is pumping and giving to the baby and also giving formula milk, but now wants to shift her baby from bottle to breast. In that case, we will ask the mother to keep pumping to keep milk supply up. And along with that, for direct feeding, she has to try for every demand of the child. Now, if the child is demanding 8 times, you need to make your attempts at least 8 times. So if in 8 attempts, even if the baby comes for 1 time, according to me, that is a win. That is the first milestone or the first win. Now, if the baby starts coming even for few seconds, 1 time also, then we can scale it further. It gives us a hope that yes, we can get the baby back. So there are a lot of things which we need to work around, like a lot of cuddling, a lot of skin to skin, and peaceful mind of the mother, giving a hope, knowing that somebody is also caring for you, knowing that somebody is equally bothered about you, that your child should breastfeed. Then when you know that there is somebody who asks you every week, what did you do, how the things went, then you feel supported, you feel empowered, you feel that, okay, I am cared. So that way, it is always a good thing to work as a team with an expert. I hope that was clear. Now, next question is from Nilima. My baby is 2 months old, giving formula milk exclusively due to low milk supply. Now want to switch to breastfeed. So we have just discussed about this, that if your baby is on exclusive formula, then we have to work what if the process is called as relactation, where we have to see if the milk supply has dropped to 0 or few drops. Then we have to give the pumping routine and first increase the milk supply. If the milk is already coming some 10 ml, 20 ml per pump, then we will scale it for direct feedings also and for pumping also. So that depends. And because the child is 2 months old, we can try for direct feeding very easily into this. Next is from Safia Anju, latching. So only writing a word latching will not help me. You have to write a specific query around latching. Next question is from Nimisha, low milk supply. So what is low milk supply? When you are writing questions, please write in detail what is your question. Just writing low milk supply will not make me understand. There are a lot of things in low milk supply. Next is from Ankita Kumari, depressed because of low milk supply and failure of breastfeeding. So first of all, please don't be depressed. This is like a general problem which is nowadays affecting 95% mothers. You know, the rate of breastfeeding in India is only 56%. And we are talking about rural and urban both. So imagine India, where the cultural things are so strong, when we are so connected to our roots, the breastfeeding rates are only 56%. So don't feel depressed that, oh, I am having this. I am the only one who is not giving my child my milk. I don't feel guilty. Don't feel depressed. Everything has a solution. You need to reach out the right person. If you would have reached out to your pediatrician, if you have reached out to your gynecologist and not got help, then please don't worry, because there are experts for everything. You can't go for your gynecology disease, your problem, to an orthopedic doctor. Same way, you can't go for an orthopedic problem. If you have if you have pain in your knees, you can't go to a gynecologist for that. So same way for lactation, you need to go to a lactation consultant. Lactation consultants are specifically trained about lactation or breastfeeding issues. So if you have gone to a gynecologist or a pediatrician and not got issue resolved, or you ask your neighbors or your friends, or you worked around the tips what your families have given it, then how will your issue get resolved? You need an expert, you need a doctor, you need a lactation consultant. Clear? So please don't be depressed that, oh, I am a failure at breastfeeding. So now, as we talked about, first of all, we will not be depressed. All of us will take a pledge that we will not be depressed. Now, failure of breastfeeding. I don't believe in failure of breastfeeding. In my career of 14 plus years, failure of breastfeeding, I have seen mainly 1 or 2 cases, that too because of the hormonal issue. Otherwise, failure of breastfeeding is not in my dictionary. You can never be fail on breastfeeding. You just need to work around proper treatment procedures. You have to be doing proper follow-ups with your doctor and work around with them and get on exclusive breastfeeding. If not exclusive, at least mixed breastfeeding. But you can't say that I am a failure. There is no word like failure in my dictionary around lactation or breastfeeding. Next question is from Jyoti. Low breast milk. Again, please don't write random things to me. Write specific queries so that I can answer. Next question is from Sonika. I am having low milk supply and my baby is on formula. So low milk supply, I have already answered. Kiran, low milk supply. Answered. Divya Patel, low milk. Priya Navar, low milk and latching issue. Nasira, low milk, baby latching issue. Sophia, low milk, flat nipple. Okay. So this is something new, flat nipples. So there are many things about flat nipples, inverted nipple, small nipple, long nipple, and mothers think that my baby is not able to latch because of all these conditions. So first of all, please forget all these things. You don't have to latch with your nipple to your baby. You have to latch your baby with the areola. And areola, thank God, universally all the females have. So you can't say that because I have flat nipples, inverted nipples, my baby is not latching. So it is not at all a condition that if you have inverted nipple or flat nipple, your baby will not latch. Basically, here you need to learn the latching techniques. So when we talk about breastfeeding holds or breastfeeding positions, there are 6 conditions or 6 holds which have to be tried upon. So depending on what is the nature of the baby, how is the mother comfortable, there are 6 holds. The hold which I prefer is cross cradle hold. So in cross cradle hold, the side where the mother is feeding, she has to hold the breast in U shape from below. So this way, when she's supporting the breast and then bringing the baby from with the opposite hand, then and opening a mouth wide open and pressing the breast. So it will give a pout of the areola which the baby will latch. So if it is a flat nipple, inverted nipple, any kind of nipple, the baby will be able to latch properly with the areola, and then mother has to keep her hand here itself to support the breast. So that once the baby starts latching, the nipple or the areola doesn't come out from the baby's mouth. So basically you have to learn. Latching is a skill. Nobody taught you. Nobody taught you how to be a mother. Nobody taught you how to have your proper breastfeeding. So obviously you have to learn it. The best time was during pregnancy, but it is gone now. So if you know any pregnant mother, please connect them to us so that we can teach them during pregnancy how to work upon breastfeeding issues. They should know everything during pregnancy itself. So now for you all, you need to learn. You need to learn the skills of latching. So latching is a skill. So for having a proper latch with flat nipples or inverted nipples, you need to learn the right techniques. So we have latching expert in our team. If your milk supply is very good, you are not giving formula milk or you are giving only 1 or 2 times of formula milk, please reach out to the team and get your consultation this scheduled with our latch expert. So I have trained one of my team member as latching expert. She helps the mothers for latching issues. So if your milk, but here is the condition, your milk supply should be really good. So if your milk supply is not that good, then you have to work on both milk supply and latching issues. So we have 3 more doctors along with me in my team. If you're not getting my consultation, because there are some waiting periods in my consultation, if you're not getting the consultation with me, you can schedule it with my other doctors. My other doctors are equally trained. I have trained them all. They are all trained under me. The things which I teach the mothers, they are same things they are only teaching me. So basically, you don't have to worry that if I am not getting Dr. Tanima's consultation, you can please book it with my other doctors also. Next question is from Sapla, latching and low milk supply. Komal Desai, no milk production. I've already answered all these questions. Mamta Sharma, मुझे milk नहीं आ रहा है. Sanchita, low milk supply. Dr. Niharika, latching issue and low milk supply. Vedika Lalwani, low milk supply. Divya, low milk supply. Ankita, अभी formula milk दे रहे हैं लेकिन breastfeeding कराना चाहते हैं. Karishma, after feeding nipple pain. This is something new. So let's understand nipple pains. So nipple pain will come if you are having latching issue, but there are 2 types of pains, during the feeding or after the feeding. If the pain is after the feeding and is like needle-like sensation, or you feel lot of heaviness in the breast, or you feel throbbing pain, then that is not because of the latching. That is because of the let down reflex. So in that case, you have to apply ice cube on the breast so that the breast becomes numb and you don't feel that. But if the pain is only on the nipple and you are feeling it during the breastfeeding or after the feeding both, and you feel that it is all over the place and basically more in the nipple area, then this is a latching, due to latching. Then there you need to work on the latching techniques. Next question is from Monica, low milk supply. Sri Priya, low breastfeeding. Smriti, low breast milk. Pamta Ganesha, low flat nipples, latching issue, already covered. Megha Agarwal, low milk supply. Hardika, latching and low milk. Pooja, low milk. Malika, low milk. Tanvi Sheikh, breastfeeding, latching issue. Anjali, latching problem, low milk. Arpita, not proper latching. Maheshwari, low milk. Pinky, having pain in breast and nipples. Poonam, no breast milk. Reema, low milk. Karishma, low milk. Simran, low milk. So all of you are low milk supply. Then what are you all waiting for? This will not get solved by itself. What are you all waiting for? You know that we have experts. What are you all waiting for? That should we go for it or not? If you all are having low milk supply, please reach out to our doctors. Get your consultation done. Preeti Singh, I am mama of twins and I have low milk supply. So now let's talk about twins. So basically with twins, what I have seen that once one baby starts crying, the other one also starts crying. Second thing, I have mostly seen that one of them is good at latch, the other one is not at all latching. So here are different conditions for twins. If you are giving only formula and you want to have breastfeeding for your twins. Now, if you have a good support system, you can try for direct feedings and for pumping. But if you don't have a good support system, you live in a nuclear family, you are the only caretaker of your child with your husband, and your husband is already doing his job or busy with something, then I would suggest please pump. At least you will be able to give breast milk to your child. Because with pumping, you can do with the variable pumps. You don't have to pump and keep sitting at a place. So that way it will become easy. And once you start seeing good milk, your baby start little growing up, then you can latch them also. Third thing is if you are giving mixed feeding and you want to get on exclusive breastfeeding. So if your babies are already feeding, then you have to work that both the babies can be fed together, and that is with the football hold. That you need to become pro at that so that you can feed both the babies together. And that can be taught. That can be worked upon with our latch expert. If your babies are on mixed feeding, where the babies are, you're pumping and giving milk and you're also depending on formula milk. There we need to work around your pumps, your schedules, so that there is good milk coming in. And always remember, please don't worry about the quantity of breast milk. You can see the quantity, but composition you can't see. So basically, when we talk about quantity and composition of breast milk, then only two factors are more important. What is the baby's formula intake and what is the baby's weight gain? If the formula milk is not increasing or the formula milk is decreasing, but the baby's weight is increasing, and if your baby is more than 3 months, baby's height is increasing, then you are on the correct path. Please don't bang your head on the quantity of breast milk. That is one thing which I teach each and every mother. I have even seen with 20 ml of breast milk whole day, 2 bottles of formula comes down. So please don't worry. Just believe on your breast milk, your composition of breast milk. Your breast milk is elixir of life. That is like amrit. So you have to first understand and believe in yourself that you can exclusively breastfeed your child. Next is Avisha, low milk supply, Nazneen, latching issue, Pooja, low milk, Mohini Jagtap, latching, cracked nipples, and pain while feeding. So cracked nipples and pain while feeding is all because of latching issue. Mohini Jagtap, you need to work on your latch. Reach out to a latch expert and get this issue resolved. Otherwise, you will start having infection in your breast. They might also start bleeding. It is not good for your health, and also it will stop, like, you will not be able, you will have to give a gap to your child for breastfeeding. And babies, once you start giving bottle to them, they get used to the bottles. So that's why get this issue resolved fast. Zohra Fatima, latching issues. Payal Banjara, low milk. Himanshi Sharma, low milk. Sai Shruti, low milk. Pralipta, low milk and incorrect latch. Shruti, low milk. Haripriya, low milk. Likita, short nipples and low milk production. The short nipples I have just covered. There is nothing called as short nipples or any issues because of latch. Basically, or the nipples, you need to work on latching the baby with the areola with the proper latching techniques. Snake Kiran, low milk. G Rani, do not whether milk is sufficient for the baby. Good question. So how do you know, is my milk sufficient for my child or not? The only thing you have to see, if your baby is gaining good weight, or if your baby is more than 3 months, the baby is gaining height. If your baby is gaining weight and gaining height, and you're not giving formula milk to your child, you are doing very good. You need to track your baby's weight weekly. Sunday to Sunday, keep tracking your baby's weight and what weight you need to target. Up to 3 months is around 200 grams per week. 150 to 200 grams, I'm okay. From 3 to 4.5 months, it is a 150 to 100 grams per week. From 4.5 months to 6 months, it is around 100 grams per week. 6 months onwards, it is 50 grams per week. Deepti Sahu, low milk. Poonam, no breast milk supply, latching problem. So Poonam, if it is no breast milk, then first you have to work on breast milk, then latching problem. Ashwini, low milk. Atar Sania, breastfeeding. What is breastfeeding? What is this question? Breastfeeding. Are you right? Question, Baba. Chinmaya, baby can't latch. I can't direct breastfeed my baby since 2 months. Pooja Agarwal, low breast milk. Anita Gola, latching and low milk. Zeenat Sheikh, my baby is 9 months. मेरा बच्चा एक ब्रेस्ट फीडिंग करता है अब तक. मेरा ब्रेस्ट एक बड़ा और एक छोटा हो गया है. देखने में बहुत ही शेप लगता है. अच्छा, मैं बहुत ट्राई करती हूँ दूसरे ब्रेस्ट से फीड कराने के लिए, बट बेबी लैच नहीं करता. अगर आपका, क्योंकि 9 मंथ्स का बेबी है जीनत, तो अगर अभी बेबी अगर लैच नहीं कर रहा, क्योंकि 9 मंथ्स का बच्चा समझदार हो जाता है, तो आप फिलहाल दूसरे ब्रेस्ट से आप रेगुलरली पंप करिए और नींद के टाइम पे बच्चे को फीड कराइए, या फिर जिस तरफ से आप ऑलरेडी फीडिंग करा रही हैं वहां जब बच्चा थोड़ा आधा, मतलब 5-10 मिनट फीडिंग कर ले, तब बच्चे को अनलैच करके दूसरी तरफ फीड कराइए और बच्चे को आप रात के टाइम पे नींद में फैलाइए, और तब तक आप दूसरे ब्रेस्ट से फिलहाल पंप करते रहिए जिससे उधर का भी मिल्क प्रोडक्शन इंप्रूव हो. प्रियंका गर्ग सेज लो मिल्क एंड लैचिंग इशू. रेवती, मिल्क सप्लाई latching. Kajol, baby is not taking formula feed because I doesn't have that much milk supply. What is this question? Baby is not taking formula feed because I don't have that much milk supply. This is not a clear question to me. Anika, latching inverted nipple. I've already answered about inverted nipple. Trupti Amin, low milk and latching. Sonia, low breast milk. Abhirami, low milk. Junaida, low milk and latching. Shagufta Khan, my baby is 4 months old and I'm facing low milk supply. So you need to work upon it. So 4 months, you can still increase your breast milk easily. Vibha, latching issues. Divya Priyanka, latching and low milk. Durga, low milk. Sandipika, low milk supply, latching problem. Shravya, low milk. Now see, most of you are having low milk supply issues. So don't think that I am the only one who is having issues. I am taking out the names. All of them have written low milk latching issues. Ashwini, my baby is on formula milk. Now I want to turn on breast milk, but it is very, very low and I have twin babies. So you can still increase, Ashwini, no worries about it. Priya, latching issue. Meena, not even a single milk supply is happening. My milk flow is stopped because I'm not giving my baby breastfeed. And this is a case of relactation, Meena. So you need to work on this. Meena Chauhan, correct. Shelly, low milk. Ratna Yadav, baby can't suck breast. Bhavna, low milk supply. Kirandeep, my baby not taking feed properly and after feeding, he's sleeping for 10 minutes and wake up. So if the baby is not taking feeds properly and feeding for 10 minutes and getting up, so what does that mean? That means your baby is doing a shallow latch. The baby is taking only fore milk. The baby is not taking the hind milk. And how you can check? After feeding, you just press the breast and see the color of the milk. If the color of the milk is thick white, that means your baby has taken only the fore milk. This baby will not sleep for long or will not play for long. Will ask the feed within 10 minutes or within half an hour. So if you see thick white milk after your latching, that means your latching is not correct. You need to work on the latching. Priyanka Garg, latching issue, low milk. Divya, low milk. Gunjan, low milk supply. Sometimes it is full and starts leaking, but sometimes very low. So girls, leaking doesn't mean that you have good milk supply or the breasts are full and it is leaking. Leaking is a hormonal thing. It is attached to the hormones. So leaking or hardness of breast doesn't mean that you have a lot of milk. So please don't associate leaking or hardness of breast to milk supply or milk production. Though both are very separate things. So leaking is more common for 6 weeks. For some mothers, it is not at all common. And for some, the leaking keeps happening even for 6 months also. So leaking is not a correct indication that you have a lot of milk. Basically, this is because of the letdown reflex, which is the oxytocin hormone. So please don't worry that I start leaking, but still I have low milk. Those are very separate issues. You have low milk, that is fine. But leaking doesn't mean that sometimes I have good milk, sometimes I have less milk. It doesn't work that way. Shavoni Day. Baby is feeding for hours during the night and also sometimes during the afternoon. She's still hungry after feeding for 3 hours at night. What's my problem? Is my milk supply low during the night? No, basically this is because of the latching issue. Baby can't keep feeding for 3 hours. That means your baby is sleeping on the breast. Now, how to know whether your baby is sleeping or doing an active feeding? As we drink water, you see the gulping movements in the neck. Same thing you have to see in your baby's neck. Don't see the chin. You can see the chin movements even when the babies are sleeping. So that doesn't work. You have to see the neck movements. So while the baby is feeding, you have to watch the neck movements. If the baby is doing an active swallowing or active gulping, that means your baby is drinking actively. If your baby is not moving the neck or the swallowing movements are not there, that means your baby is sleeping on the breast. So please don't keep latching on that and keep sitting and keep getting tired. You have to work on active feeding only. Tangyang, low milk and latching problem. Chindhu, relatching after 5 months. Pearl Seni, baby not latching properly, low milk. Jhansi, low milk. Shravanti, latching issue. Shivani, baby breastfeeding ठीक से नहीं कर पाती है. Thanuja, low milk. Attar Sania, breastfeeding. Karishma, my baby is 2 months. She latches properly as per my knowledge, but takes around 40 minutes to feed. Even it is me who removes the breast, she herself doesn't unlatch as expected. Birth weight is 2.5 kg. Current weight is 3.3 kg. So 2 months is, I need 8, 16, 1.6. So 2.5, 3.5, 4.1. So baby's weight is very less, Karishma. See, how do we calculate? We need 200 grams per week. So 2 months, that is 8 weeks. So we need 1.6 kg. 8 to the 16, 1.6 kg. So add 1.6 to 2.5. So how much it is? 2.5, 3.5, and then 4.1. Correct? So we need 4.1. And the baby's weight is 3.3. You need to work on the latching and your supply too. Visited a few doctors, they say breast milk supply must be low as baby looks lean, but my baby is active after feed and plays well. Is this sufficient weight gain? How do I confirm if my milk supply is good? What to do to increase milk supply? How to reduce feeding time to ensure more milk in less time? So basically, as we discussed, baby's weight has to be worked upon. This is too less. It is just imagine 5, 6, 7, 8, 800 grams in 2 months. That's too less. And why do we need more weight of the child? See, once the baby starts teething, they will have this loose motions and they get ill in between also. If they're already on a lower weight, then each time they fell ill, they will further lose their weight. So we need to have good reserves of weight. That's why we focus on so much of weight gain. So Karishma, you need to work on this on urgent basis. You have to work on your supply, and 40 minutes is not, you are feeling that the baby latches properly, but 40 minutes is still too long. I would prefer my child to be feeding on 15 to 20 minutes. And how to make sure? By seeing the gulping movements, and after the feeding, you should see thin white milk coming or no milk coming. That means the baby has finished the breast. So in your case, the weight is not sufficient. As I just said, active is good. Your baby is active, very fine. But I would prefer having more weight because I just told you what is the reason. How do I confirm if my milk supply is good? I already told you right now. What to do to increase milk supply? See, it is not only about the milk supply. You have to also work on the latch. You have to work on the composition of breast milk. And obviously, you have to work on the flow also. And how to reduce feeding time to ensure more milk in less time? That is by having more flow and also working on the latching techniques. So Karishma, I would prefer that you should reach out to our lactation consultants, or if you want to have a consultation with me, but that you can just talk to the team tomorrow. BGM, low breast milk. Gitanjali, latching and low milk. Lalita, low milk. Shivani, baby breastfeeding ठीक से नहीं कर पा रही है. Shreya Patel, latching problem. Jyoti, low milk. Gitanjali, latching and low milk. Madhurima, breastfeeding. Rekha, lack of breast milk. Shabnam, low milk supply. So these are all the common things I've already answered. Now let's take the questions which are there in the chat box. First, I'll take the Q&As. Trupti Amin, low milk supply issue क्या करो? ट्रुप्ति मैंने अभी आंसर किया है. अगर आपको फर्दर और कोई क्वेश्चन है तो प्लीज आप फिर से लिख सकते हैं अपना क्वेश्चन. Jyoti, how to increase milk supply? Jyoti, मैंने I already answered about how to increase the milk supply. If you still want to have this more, you can, like, if you have further questions, you can write. Anonymous attendee, when we take Perinom tablets after food or before food? So preferably before food. Sneh Kiran, ma'am, I want to ask you, my baby is 2 months old taking formula milk. Then obviously you have to work on breastfeeding and improving your milk supply so that you can give exclusive breastfeeding to your child. Jhansi Jadhav, is it possible to regain good supply after 90 days? Yes, definitely. Shruti, how to increase breast milk supply? Already answered, Shruti. If you have more questions, specific questions, you can ask. Madhurima Sengupta, I have twin babies. They used to breastfeed till 4 to 5 months. Somehow they stopped latching. Now they are 8 months. Will I be able to breastfeed again? So milk supply, I can say you can definitely increase for 8 months baby. For latching, we need to work upon. Every child are different and you have twins. So I understand there are a lot of things and a lot of things to take care. So I can't promise that both of them can latch, but for milk supply, we can definitely increase. Sri Teja, it's fourth day. Baby is sleeping most of the times and not latching properly. So for newborns, it is very common because they have a sleep cycle of 14 to 15 hours. So what you need to do, you need to keep latching. And if the baby is sleeping a lot, not getting up, then you keep expressing the milk. Please don't pump a lot. You can hand express, because even small quantity of milk is okay for a 4-day baby. You need to just keep expressing every hour or every 1.5 hours. And whatever quantity of milk in drops you are getting, that is colostrum, please keep giving it to your child. Snake Kiran, my baby latches, but I have no very low milk supply. Please help, my baby 7 weeks old. So Snake, please don't wait further. Your baby is already latching, but you are having low milk. You can increase your milk very fast. The babies who are latching but still are not getting less milk, our mothers are facing low milk. For them, it is the easiest, because the babies are already latching. We have all the reflexes in place. We just need to push the milk supply so that the baby can latch properly. So Snake Kiran, please reach out to the team tomorrow itself and get your latching and your milk supply issue resolved. Let me see if I can help you all in one thing. Fine. So you just reach out to the team tomorrow. Durga, my baby is 2 months, 15 days. I'm not producing enough milk to my baby. I'm introducing him to formula milk, and I give him up to 4 times a day. He latches properly. Could you please help to produce enough milk to my baby? So I have already answered this, like how to increase the milk supply. Let me repeat it again. So for mothers who are, like you said, that your baby is, you're giving formula milk 4 times, and he latches properly. So I hope you are every time giving your milk, and when it is not sufficient, then only you are giving formula milk. If this is, if the way this you are doing, that is perfect. You need to just work on your milk supply basically, and your latching and the flow. So you have to increase your water intake, hydration. You need to work upon that. For improving the flow, you have to do oil massage and warm compresses on the breast. You need to have some galactogogues. The galactogogues which I recommend are lactomagic powder and Morocco tablets. Along with that, because you're giving only 4 times of formula, so we don't need to give allopathic tablets into this. And also you need to have a lot of skin to skin and cuddling with your child, and you have to keep track of your baby's weight and how much formula you're giving. So just do that on a weekly basis and track it. Try to work 1 week by yourself, but if you're too confused, not sure whether it is working for you or not, then reach out to the team and have your consultation done. Anonymous attendee, how can breast milk supply increase? I've answered again. So I've answered twice now. Madhurima, milk supply is also low. Snake Kiran, ma'am, I need to ask you that if I consult you on Zoom, will it be useful? If I can't come down to clinic. Yes, so we have 98% consultations online. We don't ask the mothers to come to Lucknow to have consultation with us. Even mothers from my same city are taking online consultations because it is easier with a small baby. Sometimes it is raining, sometimes it is so hot, sometimes it is so cold. It is not feasible to carry your child and come to the clinic. And most of the times when the babies are coming to the clinic, they sleep. So that's why I would also prefer having online consultations, and we are getting such good results with online consultation. You don't need to come to the clinic. You can have the consultations on voice call or video call, whatever you prefer. Sophia, I have flat inverted nipple. That's why I'm feeding my baby with nipple shield. Because of nipple shield, my baby's lips getting injured. So you can remove the nipple shield, feed in cross-cradle, hold the breast properly and press so that the pout is formed of the areola and the baby can latch with the areola. You can remove the nipple shield, Sophia. Megha Agarwal, my baby is 40 days old and he's on mixed feeding with very low milk supply. After every feed, I have to give formula milk and I can't understand how much breast milk he's getting on every feed. So Megha, what you need to, for a 40 days old baby, what you can do, you can check the baby's weight per week. So your baby should gain around 150 to 200 grams per week, and you keep a track of how much formula milk you are giving. So in 1 week, you see if the formula milk is increasing, then that means you are facing low milk. Your body is not producing the same amount as per required by your growing child. But if your formula milk is coming down or the formula milk is not increasing, but baby's weight is increasing, that means you have enough milk. But if you feel that I still have to give formula and I don't want to give formula, then you need to have expert opinion fast, so that because 40 days we can easily work like faster. The results will be much faster into that. So always, girls, remember, the smaller your baby, younger your babies are, and you take the consultation, that will give you best results. As the age advances, the issues are more prominent, and then it takes more time for us to get the results out of it. So, Megha, this is what I would advise you. Pujita, what amount of milk third month baby intake per feed? Is there different amount of intake for formula and breastfeed? Good question, Pujita. So now imagine, Pujita, suppose you are 20 years old and other women of same age, 20 years old. Both of them will not eat same food, correct? Same quantity of food, same kind of food. So a third month baby, baby one, and a 3 month baby two will not have same quantity of breast milk or formula milk or mixed feeding. So what is constant is baby's weight gain. Whatever X amount of weight, what is the baby born? Any baby who is born with whatever birth weight, the baby should increase 150 to 200 grams per week till 3 months. So you have to calculate what is your baby's birth weight and what is the current weight, and calculate. If the baby is gaining 150 to 200 grams per week, then whatever amount of milk you are giving to your child is perfect for your child. If your baby is gaining more than this, that means the amount of milk which you are giving to your child is more. If the weight is less, that means the amount of milk which you are giving to your child is less. So this way you will be able to calculate it for your child. I hope it is clear. Ratna Yadav, I can't latch properly my baby and low milk supply. Already answered. Shawnee De, live milk supply during the night. Baby is feeding for 3 hours and still crying for milk. She is directly feeding. I already answered, Shawnee. Nasir Arif Sheikh. Madam, I have problems since from evening 6 o'clock to night up to sleep. Milk is not coming. After a nap, milk comes. So basically what happens, evenings mostly mothers feel less milk because there is a hormone called as prolactin, which is at the peak between 12 a.m. to 5 a.m. So mothers have better milk in the mornings, and this prolactin level keeps decreasing and becomes the least in the evening. So that's why mothers face low milk during the evenings. Now, how you can increase it? Naturally. So what you have to do, a lot of cuddling with your child, and when you're feeding the baby in the afternoons and evenings, have more skin to skin contact with them. Try to have good positive touch with your child. These things will naturally improve oxytocin in your body and also will help to improve the prolactin secretion. Also, we need to work on why is the milk supply going low in the evening. Are you supplementing your child or with formula for last few weeks or few months? If that is the case, then because of the disturbances in supply and demand chain in the evening, the milk supply goes down for some mothers in the evening. So that's why we need to first find out the cause and then work according to that. Shawnee says low milk at night. So basically, I just low milk at night. No, it will not, because from 12 to 5, you will have good milk. If you are facing low milk, that means you have been supplementing your child with formula or express milk in the night. And because of that, the milk supply has gone low for you in the night. So if it is the case, you need to work on direct feedings or pumpings in the night. So get back on track. Navya, my baby is 5 months old and I feel my supply is low as she is gaining max 300 grams per month. And she feeds for 5 minutes from one breast per feeding. She does dream feeding and doesn't demand for milk even for 5 hours. This is causing me stress and worries. Yes, for 5 months, baby, but for 300, but still 300 grams is very less. So 5 month baby, at least I need around 400 to 500 grams per month. And what is the weight? You need to just tell me what is the weight. So just calculate as per the weight, birth weight. I just told you the calculation, how to do the calculation from the birth weight. If it is as per the birth weight, if the weight is fine, then don't worry. And also you need to check the height of a 5-month-old child. If the baby is tall but lean, that's also fine. It's okay. Now, but you said that she feeds only 5 minutes one breast. Actually, 5 months baby do that. How you can check? After feeding, you can just press the breast and see the color. If the color of the milk is thick white, that means your baby is not latching properly and not finishing the breast. So this way you can check. Nasir Arif Sheikh, Madam, I have low milk supply, particularly time from evening 6 to night up to take a nap. After 2 to 3 hours of sleep will again start coming. Why? What is the problem? I just answered about this. Ashwini Kalor, I have twin babies. They are around 3 months old. They are on formula milk and I have very low milk. Baby is not latched. They cry too much. How can I turn on the breast milk? I have very less milk. It means 10 ml in a day. So first I would suggest work on the milk supply, because your babies are twins and 3 months old. Already you have a lot of things in your hand. You are, obviously I understand you would be having too much things to do. First work on milk, because 10 ml per day is very less. To work on milk supply, once the milk supply starts improving, you have little confidence, start latching them. Whoever latches first, focus on one baby first and then have your second one also. This way, slowly get on exclusive breastfeeding. Don't try to run, have a brisk walk and reach your destination. Neelam Lodha, low milk. Anonymous attendee, my baby is feeding for hours at night and still cries for milk. Why does this happen only at night? Basically, basically night 12 to 5 the milk is fine. As I just said, if you have been supplementing in the night, then it might go low. If the baby is sleepy and not doing an active feeding, then the baby might be feeding for long hours. So in that case, you have to check the gulping movement and the swallowing movement of the baby. Anonymous attendee, please advise for milk supply. I already answered. Gayatri Singh, if I'm using a breast pump, will that create confusion for my baby between nipple and bottle? So if you are doing a predominantly bottle feeding, then fine. But if you are predominantly breastfeeding and pumping and giving in between, then it might confuse. Or see, babies are very different. Some of them are highly sensitive, will have a lot of issues with bottle and breast. But some of them easily switch between bottle and breast. So don't worry that will this happen. You need to study your child. What works for your child? If your baby is happily switching between bottle and breast, it's fine. The bottle, you just need to take care of a few things. That bottle should not, the milk should not come by itself. You need to have a bottle where when you turn the bottle, the milk should not drop by itself. The baby has to suckle to get the milk. Second, the whole size. It should be newborn size. Please don't increase the whole size. If you increase the whole size, it will become easy for the child to have milk from the bottle. So if you keep these things in mind, I don't feel that the baby will have confusion. But if still your baby is having confusion, then you predominantly breastfeed and you can give this express breast milk with katori spoon, or these days some bottles are available which have this spoon in the front. So you can use that also. Snake Kiran, which pump do you recommend? I usually recommend this hand-free pumps. So hand-free pumps, there are few things like Morrison, Bump to Cradle, Health Sense, these 2-3 brands, because I hear it from mothers and they work fine. So basically, it is all my experience as per you all. What pumps you all are using and you're all satisfied with them, that brands I keep suggesting, because I personally don't prefer having a lot of pumps. I would prefer having the babies directly latched on the breast, but I understand there are a lot of things to work upon. Then you can go for the hand-free pump. Next is from Chindu Lingnesh. Hi ma'am, my baby is 5 months old. Due to medical issue, I can't feed her, so she switched to formula. Now all my problems solved, medicine stopped. I tried relactation with lactation consultant help. Also, I am getting maximum 5 ml per day when I pump. Baby also not latching, she prefers bottle. Also for first child, I was able to breastfeed her until she turns 2 and voluntarily I stopped her breast milk. Now I want my child to latch me. Is it possible at 5 months of old, 5 months of age? So first of all, see, Lignesh, you need to work. See, I can't promise that the baby will latch, but for milk, you can definitely increase. You said that you are getting only 5 ml per day. So obviously, when the milk is so less, how will the baby latch? So first, we have to work on increasing the milk supply. So milk supply, I can definitely tell you that milk supply can be increased. But a 5 months coming baby coming on the breast, that has to be worked upon. I can promise on that, but obviously we can try. One of my 10-month baby came on the breast. So possibilities are always there, but we need to work because every child is different, every mother is different, every circumstances are different. I can teach you, I can give you tips and tricks, but if it works for your child, it is very good. Recently, one of my mother from Northeast, she was on exclusive breast milk, but she was giving with pump milk. Now her baby has started latching 5 to 6 times. So, and her baby is, I think, 4 months old. So, yes, you can get your baby from bottle to breast. And if you see on my YouTube channel, you will see a lot of success stories of babies coming from bottle to breast. So, yes, it is possible. But I can't promise on that because every baby is different, every mother is different. We can try on that. Next is Gitanjali Seni. My baby is 4 months old. She's totally on formula. And when I pump, it is just 30 ml. And she don't want to close my breast. When I try to offer a breast milk, she screams all the time. So 4-month-old formula. And when I pump, it's just 30 ml. I think you're saying that she doesn't want to directly feed. So that's why you're pumping. Okay, that's fine. See, 4 months, please don't fight with the child. That is not going to help at all. So what you can do, you can first aim to give exclusive breast milk to your child. So you're getting 30 ml. It's not like your milk has dried up. It is not a relactation case. You're already getting 30 ml. Now, if we work on scaling the breast milk, so our first motive or our first aim should be to get the baby on exclusive breast milk, which should not be dependent on formula. Now, once this starts happening, and once you start seeing that, oh, formula milk is coming down and my breast milk, my baby is getting sufficed on the breast milk, then we can start. I can give you a lot of tips and tricks where you can start latching the child. If this works good, it's good. If it not, still you have the satisfaction that I am giving exclusive breast milk to my child and I'm not dependent on formula. So see, always we want the best things, but we have to keep our expectations low when we start anything so that we don't feel depressed at a certain point. Once we start reaching the milestones, when we start getting the results, it pushes us. It gives us hope. It gives us the feeling that, yes, we can go more. And girls, I would tell you, I am more greedier than all of you. My baby comes on exclusive breast milk. I push the mother. Try for direct feeding. Try for this. Try for that. So that way, that way, you need to first come into the ecosystem, try the things what we are suggesting, then we'll push you to have more. Snake Kiran, for how much time or long should we feed in one go? That depends on your child. See, one chapati you can eat in 5 minutes. Another mother will eat in 10 minutes. Some mother will eat in 15 minutes. That depends on people to people. So what you have to see, that the baby should be doing active feeding, gulping movements you have to see, first thing. Second thing, after feeding, if the color of the milk becomes thin white or no milk coming, then perfect. This is the good thing that your baby is able to finish all the breast milk and you're not dependent on formula. Your baby's weight is increasing. So this shows that you are on the perfect path. नेक्स्ट है ओप्पो सीपीएच. मैम आपसे बात करे हुए 4-5 दिन हुए, अभी मैं शहद लगा के ब्रेस्ट फीड स्टार्ट करा है. 2 घंटे ब्रेस्ट फीड करवा रही हूँ. बेबी 5 से 7 मिनट लेता है. कोई प्रॉब्लम तो नहीं है. भाई ये शहद मत लगाओ. कौन बोला शहद लगाने को? शहद नहीं लगाओ. ये आदत नहीं डालो शहद की. आप ब्रेस्ट मिल्क लेकर के वो लगा सकते हो, उससे आपका बच्चा लैच कर जाएगा प्लीज, लेकिन शहद नहीं लगाना है. फिर सेकेंड है, मैम मैं सारे प्रोडक्ट्स तो नहीं ले पाई हूँ, मनी प्रॉब्लम. अभी मैं लैक्टोमैजिक लिया है तो मैम प्रॉपर वर्क करेगा. 1 हफ्ता पहले पूरा करो, फिर मेरे पास वापस आओ, पहले मुझे देखने दो कि क्या हो रहा है. उसके अकॉर्डिंगली मैं आगे बता पाऊंगी कि क्या हमारा इतने से हो जाएगा या हमें और चीजें भी जरूरत लगेंगी. तो दैट वो डिपेंड करेगा कि हमको क्या रिजल्ट्स आ रहे हैं. तो अभी 4-5 दिन हुए, पूरा 1 हफ्ता कंप्लीट करो और फिर वापस आओ. Next is question is from Pinky. Ma'am, I have severe pain in breast and nipples. I have taken consultation as well. My 2 sessions are finished. What to do? If you're having severe pain in breast and nipples, there might be 2 things. Either your latching is still not properly done, or you are feeling engorgement of breast and nipples. So basically, please drop this message to helpline team. They will connect you to your doctor and will answer your question. Please do that. Pinky. Safia Anjum, how to avoid nipple confusion in baby? Is it possible that baby can have bottle feeding and breastfeeding? So I just answered this, Safia, that some babies are easily switching between bottle and breast. Some find it really difficult. So you have to see it as per your child. In what I suggest, that make bottle feeding little difficult in the way of the milk not dropping by itself and the teeth size, and just work on that accordingly. Next is iPhone. How do I know that my baby is satisfied her feeding and not hungry? See, if your baby is not asking for milk, being calm and child, like sleeping properly, gaining weight, and it's perfectly fine. Why do you want to worry about this? And you also keep seeing the weight gain. And if your baby is 3 months plus, keep check the height also. Next is from Biswajit Patnaik. Can milk increase by exclusive pumping for a 6-month-old? Can milk increase by exclusive pumping for a 6-month-old? Yes, definitely. Since intelligent baby knows bottle flow and won't latch much. Okay, that's perfectly fine, but you can still have increased breast milk and get your baby on exclusive breastfeeding with exclusive pumping. Yes. Second is milk volume is same for breast milk and formula milk in a bottle. Like 120 ml of breast milk is equal to 120 of formula in bottle. No, this is no. 120 of ml of formula milk can vary for mother to mother. For some mothers, it can be 60, 80, 90, 100, 40 also. So, same volume of breast milk and same volume of formula milk doesn't match. It's not clear because mother's milk composition keep changes throughout the day. Mother eats every day different food. So, her milk composition every day changes. While formula milk is the same, the above which you get from the market. Third, baby latches on lazy breast only when sleeping, not awake. Since small size and low supply, what can be done? So if the baby is latching on the breast while sleeping, then work on this. Try to latch her whenever she is like napping in the afternoons, in the night, and lot of skin to skin. And when you are giving bottles, try for that also. And for this flow thing, which you said that baby is intelligent, understands the flow. So you change the bottle slowly. Suppose you are using size 4, then come to 3, then come to 2, then come to 1, then 0, then newborn. Slowly decrease the size of the bottle, and so that it becomes difficult and breastfeeding becomes easier. So we have to work on the psychology, human psychology. We as humans will prefer the thing which is easier. So if bottle feeding is easier, the baby will prefer bottle. If you make bottle difficult and a lot of cuddling and good flow and good supply, then obviously the baby will prefer breast. Next question is from Pujita Mandapalli. So today already we have crossed 1.5 hours nearly. So let's see. Still we have a lot of questions. I will not be able to take the questions which are in the chat. I will be taking this Q&A, and the questions which are left, we will be continuing next week again. So I am trying that we do this Q&A sessions regularly every Friday. I hope I will be able to do that. Just you all just keep pushing me, keep messaging me that, ma'am, we want you for the Q&As, and I'll keep coming here. So Pujita says, my baby cries a lot. Don't know why. Baby is 3 months, weight gain is good, no external infections. How to know why she cries? It's okay. See, baby's mode of communication is crying. She can't smile and laugh and say that I am enjoying your home. I really feel good that I am at your home. I love that you are my mom. I love that he is my dad. The baby will not be able to tell that. The baby's communication is basically crying. Even if they are very happy, sometimes they might not be able to understand that feelings. That's perfectly fine. A 3-month-old baby becomes more aware around their surrounding. For them, the baby starts seeing colors at 3 months. Till 3 months, their vision is black and white. At 3 months, they start seeing colors. They start hearing properly. They are able to have better eye contact. So please engage with them. Sometimes they find everything so different. So imagine you are seeing only black and white and suddenly you start seeing colors. You will be so overwhelmed every time. Oh, what is this? Oh, what is that? And that will make you cry. So that's why having a lot of cuddling, a lot of skin to skin with your child, talking to your child, having good eye contact. And one more thing, any music which you have heard during pregnancy, please try to play the same music now. The babies connect with it better. So that way you can have a more calm child and more happy child. And first, you stop worrying about it. This is very normal. Next is from anonymous attendee. Is it required to give feed 3 hourly for 3-month baby? No. How many months it's required to give 3 to 4 hourly basis? It's not. Please do demand feeding. And if your baby is not demanding for long hours and the baby is not gaining weight, then you need to frequently feed the child. If your baby is gaining weight properly, the baby is having height properly after 3 months, and the baby's, then you can feed the baby on demand. That's perfectly fine. Next is from Arham Azad. मैम क्या मैं रात में 3 महीने बेबी को लेटा कर ब्रेस्ट फीडिंग करा सकते हैं? हाँ, बिल्कुल बिल्कुल करा सकते हो. साइड लाइन होल्ड है, आप बच्चे को लेट के फीडिंग करा सकते हो. बस कोशिश करो हेड बच्चे का हल्का सा ऊपर हो. तो एक छोटा टॉवल या छोटा पतला वाला पिलो बच्चे के हेड के नीचे लगा दो, जिससे बच्चे का हेड हल्का सा ऊंचा रहे. बस इतना आपको ध्यान रखना है. Snake Kiran says, you mean electric pump, ma'am? Yes. Priyanka Garg. My baby is 1.5 months old. He does not properly and has a habit of taking milk through bottle only. I am pumping my milk, but the supply is not good enough to satisfy his demand. So I'm using formula milk to make him full. Now I try every day to latch him properly, but he is resisting a lot and got frustrated. What to do? So Priyanka, here are two things. First, you are facing low milk, and second, your baby is not latching. Third, also one more thing, your baby is habitual to the bottle. So first of all, don't try to solve everything all together. First thing, as a mother, first of your priority should be that the baby should not be dependent on formula. The baby should have exclusive breast milk. This is number one priority. So first, work around milk supply and work around the flow so that you are able to get with the pump or with the latch. So you said that latching is not happening. You're trying, but they're babies. So don't fight with your child. See, if you are fighting, it is not going to help at all. The baby will become more frustrated. The baby will start crying even on seeing you. If you if you open the button also, the baby will start crying. So don't work around that. Have positive affinity with your child. So first work with an aim on exclusive breast milk, no formula milk. First aim. As you are in the process of this and you start seeing improvements and you feel confident, you feel, yes, the things are working in my direction, what I want, then you try to have attempts for latching, but respect your child. If the baby is refusing, rejecting, leave it. Slowly have a lot of skin to skin, lot of cuddling, lot of positive talks with your child. I know 1.5 months you will not be able to talk, but still I would suggest talk to your child. Maybe the baby is not responding, but it is going inside the subconscious mind. So have this contact with your child. Slowly, once the baby starts latching in a calm way, then scale this up. Okay? So have the things one by one. Don't try to do all things together. This will be very overwhelming and very frustrating and very stressful also. Next is from Snake Kiran. I feel so motivated and awesome after listening to you today because I couldn't get this guidance from my elder baby. Now I'm determined to exclusively breastfeed my child. That's awesome, Snake Kiran. I think that by working today and sitting here for 1.5 hours is successful. When you mothers tell such good things, I really feel so motivated. And everybody loves to listen to the things when they do good. They want that praises. I was a human being. I love to listen to these things. So good that you are feeling motivated. I really want you to exclusive, and each and every mother who is here or who will listen to this, I want all of you to exclusively breastfeed your child or give breast milk exclusively to your child so that you feel complete. Yes, I nurtured my baby during pregnancy. Please trust your bodies. Please trust your babies. Your babies have no personal grudges with you that they are refusing or rejecting you. They basically want milk, and that should be in a proper way. That's all. It's a good snake, Karan. Good to know that. नेक्स्ट इज फ्रॉम अंजलि सिंह. मेरा बेबी 3 months प्लस का है. मैं पंप करके देती थी बट नाउ ब्रेस्ट मिल्क बहुत कम हो गया है. क्यों, क्या करूं? बेबी मेरा डायरेक्ट फीड नहीं करता. तो आप जब पंप पहले करते तो अभी कम क्यों किया भाई? जब डिमांड कम करोगे तो सप्लाई तो नीचे जानी ही जानी है. तो जब पहले पंप करते थे तो पंप अप करना क्यों कम किया? तो पहले अब डायरेक्टली फीड नहीं करता इसलिए मैं पंप नहीं करती, ऐसे थोड़ी ना होता है. पहले मिल्क सप्लाई को इम्प्रूव करो अंजलि. मिल्क सप्लाई जब थोड़ा इम्प्रूव होने लगे या अच्छा कॉन्फिडेंस आने लगे तो बच्चे को थोड़ा थोड़ा ट्राई करना. लड़ाई मत करो उसके साथ, थोड़ा थोड़ा ट्राई करो. बच्चे को स्किन टू स्किन रखो उसके साथ. गुड टॉक्स. आपका 3 month प्लस है तो आप तो अच्छे से बात कर सकते हो. आई कॉन्टैक्ट करो. जैसे जैसे थोड़ा थोड़ा बच्चा ब्रेस्ट पे आने लग जाए आप उसको स्केल करेंगे. ठीक है. Next is from Navya. Birth weight is 3.1 and reduced to 2.9 in 2 days in hospital. At 6 weeks, it's 4 kgs. Wait. So 3.1 and 6. So हमको कितना चाहिए? 6 to 12, 1.2. So 3.1, 4.1, 4.2. We needed 4.2 at 6 weeks. 10 weeks is 4.6. So 10 into 2, 202 kgs we needed. 3.1. 4.1, 5.1. We needed 5.1 kg at 10 weeks. And from there, she is gaining 300 grams per month. She has turned 6 now. Not sure what happened from 3rd month. She started dream feeding and takes feed for 5 minutes from one breast per feeding. Navya, you need to work on this. This is, I mean, the baby is active, all good, very good. But I would like to have more weight of the child, good reserves of weight, so that once the baby starts teething, and or falls ill in between, the baby doesn't fall to below the this line of red line on the growth curve we see. So I don't think that this is good weight. You need to work on this, Navya, and I would suggest you to please do it on an emergency basis. Your baby is already 6 months, so now the baby will be able to have the solids also. So it will not be a much challenge to increase the weight. So with exclusive breast milk and this solids, we can increase the weight. Next is Tanuja. My baby is choking sometimes while swallowing milk. How to avoid choking? Good question. So for choking, what you need to do for latching, there are a few tips which you can do. While feeding, just hold the breast and tightly and pull it little back so that gush of milk doesn't come in the baby's mouth, so that the baby doesn't choke. Second, if this doesn't work for you, please hand express some milk and take out some milk and then you latch the baby. So these 2 things you can try to avoid choking. Anonymous attendee, how to know height chart? So there is a tracker, there is an app called as Child Growth Tracker. You can find it on app this Play Store or on iPhone also it is available. So you just type the name Child Growth Tracker and you will have a app. In that you put all the baby's parameters. So it will give you height and weight curve. So this way you will be able to know what is the ideal height for your child. It even has as per the premature babies also. Next is Tanuja. I started exclusive breastfeeding from 1.5 months. Weight gain is 500 grams when she reached 3 months. She does not sleep well in the morning. 20 minutes nap 3 times in a day. She takes nights. She sleeps for 8 hours. Yeah, so if she's sleeping 1.5 months, she's sleeping 8 hours in the night, then obviously she will sleep very less in the days. I would not suggest 8 hours for a 1.5 month. She reached 3 months. Now she's 3 months, I suppose you are saying, and she sleeps for 8 hours. So 8 hours is a little longer time. I would prefer not letting the child sleep for so long. You can give some milk or you can latch her on the breast in midnight once. 8 hours is too long for a 3 month baby also. And rest in that, obviously, when she sleeps properly in the night, she will sleep less in the afternoons or in the day. That's fine. You just engage your child, have more activities with the baby so that the baby becomes little tired and sleeps in the afternoons also. Anonymous attendee, हेलो मैम, मैं ममता शर्मा हूँ. मुझे बस 15 दिन ही मिल्क आया, 10 ml तक. उसके बाद बिल्कुल बंद हो गया. मेरा बेबी प्री मेच्योर है, 1 महीना नर्सरी में थी, अभी 3 महीने की है. अब मेरे तक मेरा मिल्क नहीं मिला उसको. मैंने सब ट्राई कर लिया, प्लीज आप बताओ मैं क्या करूं. अगर आपने सब कुछ ट्राई कर लिया है और 3 मंथ्स का बेबी आपको ऑलरेडी हो गया है और उस मिल्क आपको नहीं आ रहा और प्री मेच्योर बच्चा है, तो ममता मैं आपको प्रेफरेबली तो यही कहूंगी कि अब ये टिप्स एंड ट्रिक्स ट्राई मत करिए. प्रॉपरली टीम को रीच आउट करिए, कल ही रीच करिए, चाहे मेरे साथ चाहे मेरे अदर डॉक्टर्स के साथ, किसी के साथ भी आप कंसल्टेशन अपना फौरन लगवाइए, जिससे तेजी से हम मिल्क सप्लाई पे काम करें, बच्चे को माँ का दूध मिलना शुरू हो, जिससे उसकी इम्यूनिटी अच्छी हो. फिर भी अगर आपको लगता है कि मैं एक बार खुद ट्राई करना चाहती हूँ, तो मैंने कुछ चीजें बताई हैं, मैं फिर से बताती हूँ. पानी आपको अच्छे से पीना है, ब्रेस्ट पे ऑयल मसाज और सिकाई करनी है जिससे मिल्क का फ्लो अच्छा हो. गैलेटोगॉक्स में मैं लैक्टोमैजिक पाउडर और मोरिको टैबलेट्स बताती हूँ, वो आपको लेनी है. आपको बच्चे के साथ बहुत स्किन टू स्किन कडलिंग करनी है. बच्चा अगर आपका ब्रेस्ट पे कुछ भी आ रहा है, तो जितनी बार भी वो बॉटल लेती है, हर बार उसको ब्रेस्ट पे जरूर लगाइए. अगर वो ब्रेस्ट पे नहीं आ रही है, तो आपको फिर पंपिंग से फिलहाल अभी डिमांड क्रिएट करनी होगी. लास्ट आपको बच्चे का वेट ट्रैक करना है और बच्चे का फॉर्मूला मिल्क कितना दिया जा रहा है वो ट्रैक करना है. जैसे जैसे आपका बच्चा बड़ा हो रहा है, उसका फॉर्मूला मिल्क बढ़ रहा है. अगर फॉर्मूला मिल्क नहीं बढ़ेगा तो बच्चे का वजन गिर जाएगा. लेकिन अगर आपके बच्चे का फॉर्मूला मिल्क नहीं बढ़ रहा लेकिन बच्चे का वजन बढ़ रहा है, इसका मतलब आप सही रास्ते पे हैं. तो इन चीजों को फॉलो करिए. अगर कोई दिक्कत आती है तो हमारी टीम से बात करके अपना कंसल्टेशन लगवाइए और चीजों को जल्दी रिजॉल्व करें. नेक्स्ट इज anonymous attendee, is it okay to sleep for 8 to 9 hours continuously without feed at night for 3 month baby? That's why I was telling that I would not prefer 8 to 9 hours at a stretch for a 3 month baby. That's why I said that in the mid of the night you can latch the baby once, or you can give some express milk to the child in between. 8 to 9 hours is too long for a 3-month-old baby. I would not prefer that. So what is the sleep chart according to months? So I would not prefer having a sleep chart. That is a human thing. Let that be a natural coming in. But 8 to 9 hours at a stretch, I would not prefer. I would not wake up the child. I would try to latch the baby on the breast. If the baby latches for even few seconds, at least that hypoglycemia will not happen. And second thing is, you can, otherwise you can give some express breast milk to the child. The main concern is for 8 to 9 hours, the issue is for hypoglycemia, the blood sugar going down. The only concern is that. So for that, you don't need to give full 120, 150 ml of milk. Even few amount of milk is fine for that. That's all for today. The questions have been answered, which are there in the Q&A. And if you have any specific questions left, then you can join again next week. We'll have it again and then we'll discuss it further. Already it is too much time and I know that you all have small babies. So we'll connect again next week, and so that we'll have some more question answers. And if you want to have consultations with us, we are all there for all of you. I hope the session was helpful. You can just message us so that we understand that the session was good, it was helpful, because if it is helpful, I'll keep doing it. If it is not much helpful, that you feel that there was nothing new told to us, it's all fine, this we already knew, then there is no use of coming in every time. So your hearts are telling me that you all are happy, you all felt that it was value. So I'll keep doing that so that I'll try in my best possibilities, however I can help you all. So that's all for today. Good night, everyone. Take very good care of yours and your small babies. And lots of love and blessings to you and your child. Take care. And very soon I'm even going to I'm planning once these lactation questions are done regularly, then we can have some mother to mother conversations. The journeys of yours as mothers, what do you expect from you? I would like to explore that kind of thing also with all of you. There we will have the meeting format where we'll discuss things. You can open your heart. We will be like a ecosystem where we can help each other. And I can share how I passed on my motherhood journey and how I worked on that, so that you have an experienced person telling you how to navigate through that. So few, because I have started this Q&A after a long time, so there are a lot of questions around breastfeeding. Once these questions get subsided, then we can have these conversations going in, so that that will be helpful in another way of dealing with the second inning of being a mother, how to handle that, and how to handle our as careers and how all these things. So we'll try to cover that in our upcoming sessions. So be connected, keep coming in these Q&A sessions. So take care, everyone. Good night.